Hi, I'm Dr. David Greene, CEO of the Florida Pain Network, where we connect those in pain with pain management clinics throughout the state. Today the topic is, what does it take to get a spinal cord stimulator implant? It's one of the most revolutionary procedures technologically in pain management over the last 20 years. And what it does is it can mask pain, doesn't fix anything, but it can nicely mask pain in a person who has no other options. They've had spine surgery, it didn't work very well. They have maybe scar tissue around a nerve root that is not fixable by surgery, so no further surgery is indicated. Pain medications and other interventional type procedures are just not quite cutting it. There's nothing left. The last resort, a spinal cord stimulator implant can work really, really well. Very high success rates with the latest and greatest technology with those implants. But what does it take to get one? Okay, there's two steps. Number one is a trial spinal cord implant. Okay, and what that is it's an outpatient procedure. The pain management doctor will sedate the patient, but they can't knock them out because they have to numb up the skin, put the little catheter lead through the soft tissues and into the epidural space around the spinal cord. Okay? Then what they do is they situate the catheter and then they turn it on by attaching it outside the skin to a battery pack. That's a programmer. And they program it and they say, okay, do you feel this tingling that it's producing? And does it cover the area of your pain? So if you have right leg pain and that tingling replaces where the pain is in the right leg, they have it in the right area. If not, they just keep sort of moving it delicately around until it covers. Then it's situated, then it's sutured outside the skin, sterile dressing. You keep it for 5 to 7 days, and then you tell the pain doctor, after they take it out in the office, just a little cut the suture and pull it out, painless, if it worked. If so, how well did it work? Now, if it worked 50%, 80%, that's typically good enough to go onto a final implant. You have no other options, right? Surgery is not going to help anymore. That's been deemed to, so as a last resort, this can work beautifully. So you've been approved, given the thumbs up for the spinal cord stimulator implant. Not so fast, you have one more step. And that second step is called a psychological screening. And that means you have to go see a psychologist, fill out some instruments like the Minnesota multiphasic kind of a thing, and then probably have a one-on-one interview. And what that's looking for is mental health conditions. Because if you have undiagnosed depression or anxiety or catastrophizing, one of these types of mental health conditions, it can truly make the spinal cord stimulator implant less successful. There's been studies showing that, so psychological screening is required by the vast majority of insurance companies. So you can sit there and say, oh, I'm not going to do that, it's not necessary. It can help diagnose things that you didn't know existed. And your pain management doctor might not know existed. Okay? Those can be treated before the procedure, and they can enhance the outcome. Very much so. Okay? So those are the two steps, trial and then the psychological screening, and then the procedure itself, assuming those others are copacetic, and it can work really well. 75 to 85% good to excellent results are now being shown with the latest spinal cord stimulator implants. Check out our website at floridapainnetwork.com. We connect those in pain with pain management clinics throughout the state. If you go on I Need a Pain Doctor, put your zip code in, the options will pop up that are closest to you. Some take Medicare, some take only self-pay, some take a lot of insurances, workers' comp, personal injury. You'll see in the description. And if you have any questions, just call us, 877-877-8556. I'm Dr. David Greene, CEO of the Florida Pain Network. Your pain stops here.